Hello, and welcome to Creating a Space for Students with Disabilities and Neurodiversity in the Classroom. My name is Crystal Sujong Cho Jones, and thank you for coming to my presentation. About myself, I am currently a graduate student at Indiana University in the MS Education program in special education. I have lived in South Korea for over 5 years teaching. I'm also doing my research and fieldwork here as well. So in this presentation, I'm going to define disability, neurodiversity, learning difference, and learning disability. Is there early childhood intervention in South Korea and what is available? How to create a space for our students with disability and neurodiversity? And of course, creating a safe space in the classroom. What is disability? A physical disability is a physical condition which affects a person's mobility, physical capacity, stamina, or dexterity. This can include brain or spinal cord injuries, multiple sclerosis, cerebral palsy, respiratory disorders, epilepsy, hearing and visual impairments, and more. Remember that not every disability is visible, so a list of invisible disabilities is chronic pain, mental illness, epilepsy, anxiety disorders, ADHD, emotional and behavioral disorders, personality disorders, and many more. Keep in mind that there are disabilities where someone needs a wheelchair on some days and other days they don't. So just because the person doesn't appear or look disabled does not mean that they're not disabled. And we shouldn't have preconceived ideas to just assume that they're abled when they're not. Defining a learning difference and learning disability. So a learning difference refers to a difficulty in learning that is more specific and not global. Conditions like dyslexia, dyspraxia, dyscalculia, and dysgraphia are all considered learning difficulties, but they wouldn't normally be considered learning disabilities because they are not global and instead only affect the ability to learn in specific areas, and they wouldn't normally affect a person's overall intelligence. Learning disability refers to someone who has an IQ lower than 70, who are intellectually delayed in every aspect of his or her life. It can be mild, moderate, severe, or profound. Learning disabilities are said to always be global and affect every aspect of the person's ability to function at the same level all around. This is very different from an autistic person, unless there's an accompanying learning disability who will more than likely have some things that he or she is brilliant at and other things that he or she really struggles with. So example, an autistic person who has ADHD or they're dyslexic. That would be considered that they have a learning difference. If they have a learning disability, then they have done an assessment, an intelligence assessment, that actually shows that they have a lower IQ. What is neurodiversity? According to the National Symposium on Neurodiversity in 2011, held at Syracuse University, Neurodiversity is a concept where neurological differences are to be recognized and respected as any other human variation. These differences can include those labeled with dyspraxia, dyslexia, attention deficit hyperactivity disorder, dyscalculia, autistic spectrum, Tourette syndrome, and others. So I will discuss will list what these are. Autism disorder or autism spectrum, Asperger's syndrome, which is also under the autism spectrum, ADHD or attention deficit hyperactivity disorder, dyslexia, which is trouble with reading, dyspraxia, which is trouble with coordination, Tourette syndrome, which is a physical and verbal tics, dyscalculia, which is difficulty in understanding numbers, dysnomia, which is a deficit in expressive languages and can't say the name of things, and mental health and personality disorders, schizophrenia, depression, borderline personality disorders, etc. There is evidence that there is underdiagnosis in female autism and sexism. So males are more frequently diagnosed with autism than females, but it is debated whether this is due to a sex difference in rates of autism spectrum disorders, ASD, or whether females are underdiagnosed. The prevalence ratio is about 3 males for every 1 female diagnosed. In a 1993 study, Asperger's syndrome in mainstream schools in Sweden found a boy-to-girl ratio of 4:1. So continuing with the sexism and female autism diagnosis, according to the National Autistic Society in 2012 survey, 42% of females had been wrongly told they suffered psychiatric personality or eating disorders, compared with 30% of males. The survey also found that just 8% of girls with Asperger's syndromes were diagnosed before the age of 6, compared with 25% of boys. It's not yet clear exactly the reasoning behind why there is more diagnosis with males compared to females and why females are being underdiagnosed. However, there has been current research to show that there is a possible difference with male autistics and female autistics and how they behave. So example, what's causing the many missed and wrong diagnosis of female autism is a behavior called masking, or camouflaging of their condition involves mimicking an unconscious attempt or learning a conscious effort socially acceptable behavior such as making eye contact in conversation, using pre-prepared phrases or jokes in conversation, copying other social behavior, and initiating facial expressions or gestures. Females who mask report difficulties ranging from exhaustion to losing their sense of identity, and camouflaging behaviors have been linked to stress, anxiety, mental health problems, and increased risk of suicide. Why are more men diagnosed as autistic? Theories to explain the gender split. So there is a female autism phenotype. Autistic females have characteristics which don't fit with the profile normally associated with boys and men. Current autism assessment tools are usually based on male characteristics, leading to underdiagnosis in females. However, it is slowly changing, and diagnostic tests for girls and women should be modified accordingly. So, for example, women and girls who do masking, there should be question specific in said test in identifying if the woman or girl is autistic. Autism traits in girls are underreported by teachers. Girls and women are better at masking or camouflaging their difficulties, which is masking. Autism is an exaggeration of normal gender differences. Extreme male brain theory, which focuses on the effects of fetal testosterone on brain development in autistics. A range of biological factors, such as genetics and sex chromosomes, may mean that boys and men have a higher prevalence of autism. Again, these are all theories, but there is continuing research in it. There's just not very many research out there. to prove the differences in diagnosis among autistic men, boys, and women and girls. What is stimming? So continuing with autism and explaining behaviors, autistic behaviors. Stimming is shorthand for self-stimulatory behavior. It is also called stereotypic behavior, which I'm sure people are probably familiar if they've met autistic people. Stimming can help make it possible to manage positive and negative emotions for an individual with autism. Stimming is commonly known as and usually refers to specific behaviors such as repetition of words and phrases, spinning, hand flapping, and rocking. However, there are other types of stimming that many may not recognize, such as dancing, doodling, chewing, picking, and or pull out their hair, which is called trichotillomania. In the picture is Agni Auntie, Sarah Jane Harvey. I'm not sure if anyone's familiar with her, but she is well known in the autistic community, and she is also an autistic person who is an advocate for autism. So I will show an image of like the different types of stimming. So these are what they look like. As a person who is autistic, I do a lot of these things. And they're used to help not only to help with anxiety. It's mostly for like self-regulating, like emotions. And I want to emphasize that it's wrong to stop an individual from stimming. So if there's an autistic person who is like, for example, flapping, and trying to prevent them from self-regulating and to stim, such as like flapping, for example, is wrong. You really shouldn't do that. I'm very much against people who are trying to advocate in preventing autistic individuals from stimming. And making it appear as if stimming is something wrong or different or weird or strange, and it's not. It is completely normal. And there's nothing wrong or negative about someone who stims. What is ADHD and ADD? So I'm going to explain the differences between ADHD and ADD and also go over the types. So someone who has attention deficit hyperactivity disorder, or ADHD, they will appear as being hyperactive and rambunctious, has trouble sitting still and might be restless, has trouble finishing tasks or following direction, struggles with impulse control, and is easily distracted and appears forgetful or careless. So this is something that most people would think ADHD is just across the board, but there are also other types. So ADD is something that is typically overlooked by people or like teachers, but it's still a type of ADHD. So attention deficit disorder, or ADD, tends to fly under the radar as they are not hyperactive but still have difficulty with attention. They often appear shy, daydreamy, or off in their own world. It is often difficult for them to sift through relevant and irrelevant information. So again, as I said, ADD is one of the three types of ADHD. So the three types of ADHD. ADHD, predominantly inattentive type, or ADD. ADHD, predominantly hyperactive impulse type. And then there's ADHD combined type, which involves both hyperactive, impulsive, and inattentive symptoms. So while I go over this presentation, I want everyone to keep in mind, to know and understand that autism and other neurological variations, learning disabilities, ADHD, etc. may be disabilities, but they are not flaws. People with neurological differences are not broken or a complete version of normal people. One of the clearest and most important revelations of stemming from brain research is that there is no such thing as a regular student. Learning is an unique to is as unique to individuals as their fingerprints or DNA. The notion of broad categories of learners, smart, not smart, disabled, not disabled, regular, not regular, is a gross oversimplification that does not reflect reality. Disability, no matter how profound, does not diminish personhood. People with atypical brains are fully human with inalienable human rights. Disability is a complicated thing, often is defined more by society's expectations than by individual conditions. Neurological variations are a vital part of humanity, as much as variations in size, shape, skin color, and personality. None of us has the right or the wisdom to try and improve upon our species by deciding which characteristics to keep and which to discard. Every person is valuable no matter the disability, physical or neurological. People who have made contributions to society that made an impact: Frida Kahlo, she had polio and spina bifida. John Nash, he has acute paranoid schizophrenia. Stephen Hawking, ALS, a neurodegenerative disease. Nick Vujicic, I think I'm probably mispronouncing his name. He was born with no limbs. Greta Thunberg, which everyone knows, is a huge advocate for environmental conservation and fighting against global warming and educating people about that. She has Asperger's. Bill Gates has dyslexia. Libby Clegg is she has Stargardt's macular dystrophy, which is deteriorating condition and is legally blind. And she is a famous runner. And there's so many more people. People with disabilities live rich, meaningful lives. The list of well-known people I mentioned earlier emphasizes this. I'm an example of that, and I'm sure there are people who are watching my presentation, listening to me, who have some form of disability or know others with a disability that feel the same way, leaving meaningful lives and making a difference. When working with students with disability, to keep in mind when you work with students, you should be patient and understanding, believe in them even when they don't believe in themselves. Have a willingness to learn and accommodate your student. These are very important when you're teaching a class and you are trying to accommodate the lesson or the environment of the classroom for your student to fit their needs. If the approach doesn't work, try a different approach. Don't give up. Be positive and welcoming to your students. It's a really big deal. Having that kind of support really helps, which follows with, being there for them to support, because it's possible they have no one else to turn to. And that support makes a huge difference for the student and actually helps with leading towards their success. Don't be afraid or treat the student as an other that you can't teach. You're a teacher. That is what you do. All students can be taught, and you don't have any control over which students you have in your classroom and which ones you don't want in your classroom. So as an educator, you should be there for your student. Your student is a person with special needs. Let go of biases. Very, very important. Please don't have preconceived notions of a student thinking that they're incompetent or incapable of doing something when they can. You just have to modify and accommodate your lessons and possibly the classroom to meet their needs, to help them succeed, but regardless, they're capable. All educators should reflect upon their own beliefs of an ableist mindset and should avoid social stigma surrounding singling out or drawing attention to needs of individuals and paramount to their success. Is there a lack of early intervention in South Korea? So I'm sure everyone's aware that cultural and social stigmatization surrounding individuals with disability of any kind, that is considered to bring shame to the family. So as a result, abuse and rejection is still a major issue that goes unreported or ignored. People with disability is discriminated against and viewed as a hindrance, stupid, undesirable, and an embarrassment to others. South Korea is built on an ableist perspective and belief that anyone who is not perfect in every way under a Confucian aspect is not competent or capable to be part of society. As a result, this has led to the lack of early childhood intervention. However, laws surrounding service provisions and education rights for young children with disability were not enacted until recently in 2008. Times are changing, but recently there has been increased acknowledgement in South Korea of the importance of early identification of children with disabilities. However, from experience and observation and speaking with Korean teachers and school administration, parents are still less likely to acknowledge their child's needs and prevent further action to receive special education assistance, use of assistive technology, involving therapy and special ed teachers, etc., which can be very, very frustrating. I've experienced this, and I'm sure some people who are interested in this presentation has possibly experienced this as well. And we can't really do anything about it, but we do have control of our classroom and what we can do for our students in our classroom. And hopefully you might be lucky to work with school personnel and other teachers that may be willing to be helping the students, modifying or accommodating to the students' needs, and of course ultimately just understanding. And thankfully I'm lucky to be working at a kindergarten hagwon where they are aware that I have, well, my boss is aware, boss and the daughter is aware that I have autism, but they are also very understanding, and when it comes to students, they are willing to try to do what they can in the classroom and help them. Early childhood intervention in South Korea today. Free screening and health. Creating a space for our students. So students with disabilities, make sure your class is accessible and easy for them to move around in. Provide assistive technology in your class, i.e. use of a highlighter, special tape to assist in reading, applications to assist in their learning, special lined paper to write on for dyslexics, closed captions for films, videos, cognitive aids, etc. These things may not be possibly available in your school, so you might have to create your own, but you can find a lot of ideas or assistive technology online, and you can just print it out or like make them yourself. I've done this before in my class, and it's helped. To explain what assistive technology is, it's assistive, adaptive, and rehabilitative devices for people with disabilities. Any item, piece of equipment, or product system, whether acquired commercially, off the shelf, modified, or customized, that is used to increase, maintain, or improve functional capabilities of a child with a disability in their learning. Continuing creating a space for our students. So students with neurodiversity, dimming the lights in the classroom. So for example, having bright lights in the classroom can be very uncomfortable and sometimes even painful for autistic individuals. Accommodate and create a space for them who are overly sensory stimulated to self-regulate. Provide things to use to distress or to accommodate to their learning difference needs. So for example, if a student has dyscalculia, you can provide graph-lined paper to help them write out the numbers individually. Or if there is students who tend to have a lot of stress and anxiety, to provide a space for them to like take a break and then be able to like, I don't know, write in their journal about how they're feeling and what is they might think is stressing them out or having a bad day, and then submitting that to you to like talk about privately and to discuss and understand what it is that the student is going through. Do not force them to make eye contact. It stresses them out and causes anxiety and can lead to meltdown. So this definitely applies to students who are autistic. Allow them to stim and do not shame them for doing it, which also, again, I've said earlier, applies to autistic people. UDL Guidelines. So UDL, Universal Design for Learning, is a framework for instruction organized around 3 principles based on the learning sciences. The 3 principles of UDL is provide multiple means of representation, provide multiple means of action and expression, and provide multiple means of engagement. These 3 principles of UDL are things that you should keep in mind when you are creating lessons, when you're doing instruction, and how you lead a class, and ways you can accommodate or modify the classroom and lessons for your students and activities and even schoolwork. So provide multiple means of representation. The first principle of UDL is the what of learning. This means how information is perceived and comprehended by the learner. Individuals perceive and comprehend information in many different ways. Keep in mind that no one medium of representation is going to serve the needs of all learners or individual learners. So for example, some may struggle with text, others may struggle with understanding auditory and need a transcript to keep track. Some may need visual aids or differences in comprehension, and so forth. Curriculum should have enough flexibility for students and teachers to determine the most appropriate way to access the content. Provide multiple means of action and expression. So this is the second principle of UDL, and it is the how of learning. This means a proactive and expressive endeavor requiring skills in strategy, organization, and communication. The way in which individuals approach learning tasks and express their understanding may differ dramatically from person to person. So what I mean by this is providing opportunities for students to produce text, which is write, to present, which is orally, what they understand through questioning, activities, and assessment. And lastly, provide multiple means of engagement. The third principle of UDL is the why of learning. What motivates students to learn, and how can they self-regulate their own learning? Teachers need to be aware that it varies from person to person. What works best for some students may not work best for others, and to implement multiple ways for students to engage. So don't assume that just because it worked for one student who has ADHD, the method may not work and apply for another different student who also has ADHD. And that just applies to all types of disabilities. Some students may need strict routines, while others are more spontaneous. Some students are most productive or learn best with specific goals, while others need a more open-ended approach. Sensory strategies to help students with self-regulation in the classroom. Allow for movement breaks or a corner in the room that children can go if they need a break. Foster an uplifting, inclusive environment in classroom. Build up the students' self-esteem by going around the room and letting students know what they are doing well. Provide a wall in the room to allow the students to write uplifting and positive messages to their classmates, or place positive and encouraging posters around the room. When your students see value in their work and effort, they will be more likely to succeed. So these are perfect ways to create a positive space for students and for the teacher, and to be able to be open and communicative. So heavy work activities. Heavy work activities are activities that involve providing input to the child's joints and muscles that provide pressure to their bodies. These can be calming for some students. So like having them hug or squeeze themselves, squeezing a fidget toy, cleaning up the desk, pushing in the chairs and lifting and putting away books, doing yoga poses, which I've done in my class, and my students really loved this. It's really helped them and chilled them out throughout the day, carrying a heavy backpack between classes, and so forth. Movement-based activities, so these will probably most likely apply to a lot of students who are young. So like getting up to stretch between activities, singing, head, shoulders, knees, and toes, and moving to the song. Assign responsibilities in the classroom and or have students run errands for you to take something to the office. So this can apply for like older students. Playing follow the leader around the room, or providing a variety of seating options for students to be able to wiggle while learning. So like students who fall under the ADHD category, who just like to move around, so like having a beanbag chair or exercise ball, wiggle cushions, or standing desks. The ability to lay down on their stomach and use a binder to hold up the paper to write. These things can help. Oral motor activities is like having a water bottle available to drink from, which I do use in my classroom. Chewing gum is another way, having a snack break, sucking on hard candy. Visual activities, which are very useful in the classroom. So if you have students who have difficulty in communicating and you have trouble in being able to communicate to the students, it's very good to have visual aids so that the student can communicate to you, because imagine the frustration of not being able to communicate or express yourself in a meaningful way that others can understand you. So this can apply to individuals that have disabilities with communication, or autistic individuals who may not communicate, or they can, but it can be very difficult to express themselves and to communicate. So using visual schedules to help with the school routine, completing color activities, completing art and craft activities, having a positive and uplifting visual poster around the room, or having visual aids that communicate their emotions or feelings, or tasks that they need to complete in the classroom, and so forth. Auditory activities is listening to music, singing songs during transitions, singing songs during lessons, wearing headphones or earplugs to block out sensory overload noise that may be overwhelming. I have students who actually really enjoy that I play music while I have them work on their assignments or doing an activity. And then from the younger ones that I work with, like kindergartners, of course, singing songs during lessons, it makes it very enjoyable and interactive. So 9 things to say to your anxious child. So you can like have little posters in your room to help feel that they are acknowledged, accepted, even educate classmates that is welcoming and can inform about differences in students' learning or even disabilities. They can be very useful and helpful. So like here's an example of like a poster about ADHD. Lighting in the classroom, like I've said before, here's some examples that you can do in your classroom to like dim the lights to make it more relaxing. Or a calm corner helps students who feel stressed or anxious to take a break. So you can have like a place where they can journal or de-stress items like a fidget spinner, or like one of those little bottles that have like glitter in it, and autistic individuals will like that too, or having some kind of like something that they can touch. So like things to use to distress, like I just mentioned before, like slime is a really big thing, or Rubik's Cubes, things that they can touch and feel to help them like de-stress. A handy chart featuring over 30 iPad apps for students with special needs. So I provided this for anyone who is interested that they can implement into their classroom and use. If you have any questions or want a copy of the presentation, you can contact me at my email. And that is my presentation. I hope it's been useful and has informed you on how to create a space in your class that is welcoming to all your students, no matter their differences. Thank you so much for having an interest in my presentation. I hope I've helped you.